colonoscopy report says that you have diverticulosis. Suddenly you're wondering, can this turn into cancer? Should I stop eating popcorn? Am I going to need surgery someday? I'm Dr. Thanjan, a gastroenterologist, and today I'll explain what diverticulosis is, what diverticulitis is, and what are the most common myths that my patients hear about them. Millions of people have diverticulosis, and most never have problems. So let's explain what diverticulosis means. So what is diverticulosis? Your colon is normally very flat, but then as time goes on, you could start developing these small pouches in the colon. And that in itself does not increase your risk for cancer. And these pockets are not infected or inflamed. Oftentimes, diverticulosis is found incidentally on a colonoscopy or a CT scan. So why do these out pockets form? They can form due to pressure inside the colon. It can oftentimes be related to age. Older patients are more prone to have diverticulosis. It can also be genetic. So what are the symptoms of diverticulosis? Usually none. This oftentimes surprises my patients. Most people feel completely normal. So what is diverticulitis? Diverticulitis is when one of these pouches in the colon becomes inflamed or infected. You need to have diverticulosis in order to have diverticulitis, just like you would think about in order to have tendinitis, you would need a tendon. So every patient that has diverticulosis does not necessarily ever get diverticulitis, which is this inflammation or infection. So what are some symptoms of diverticulitis? Oftentimes it could be left lower abdominal pain, which is the most common location for diverticulitis. It could lead to fevers, a change in bowel habits, or a decrease in appetite. So when should you go to the ER with diverticulitis? Severe abdominal pain, high fevers, persistent vomiting, your blood pressure starts dropping, you cannot tolerate fluids, or you see significant rectal bleeding. So what are the common myths that you hear related to diverticulosis and diverticulitis? Myth number one is that seeds cause diverticulitis. This is false. It's okay if you have diverticulosis to eat things such as seeds and nuts. This actually may be helpful and is good for your overall health. It is okay to eat seeds and nuts if you have diverticulosis. Myth number two, never eat popcorn. This is not true because it's not popcorn that actually goes into these small out pockets and causes the infection or inflammation. Therefore, it's okay to eat popcorn if you have diverticulosis. Myth number three is that everyone with diverticulitis needs antibiotics. Not always. Some patients can do well without antibiotics if they're having a mild episode by reducing their diet to a low residue, low fiber diet and pretty much resting their bowel, and then the inflammation heals on its own. Myth number four, you'll eventually need surgery for diverticulosis or diverticulitis. That is not the case, and the majority of patients that have had diverticulitis end up not needing to have a surgery. So how do you prevent diverticulitis? One thing is to focus on a high fiber diet that we've talked about in previous videos. Make sure to have adequate exercise and keep a healthy weight. Avoid smoking. Limit non-steroidal anti-inflammatory drugs such as ibuprofen, and to avoid excessive alcohol intake. Another question my patients often ask is, can diverticulitis come back? And yes, it can. Diverticulitis can recur in about 10 to 35% of patients after their first episode of an uncomplicated diverticulitis episode. Recurrence does not increase the risk of developing complicated episodes of diverticulitis, which would be things such as an abscess, which is a collection of infection due to a micro tear in the colon, or a larger perforation, which is a more significant tear of the colon. There are some patients that have mild episodes of recurrent diverticulitis over the years who do well without needing to have surgery. Obviously, there are patients that only have one diverticulitis episode and then never have it again. So when may surgery be recommended? Surgery could be recommended if a patient is having frequent attacks, complications such as an abscess or a tear of the colon, a fistula, which is an abnormal connection from the colon going to another organ due to the inflammation that persists at that location, a stricture, which is a narrowing of the colon, which is causing symptoms in the patient. The discussion of surgery is a very individualized decision. So what are my key takeaways for you regarding diverticulosis and diverticulitis? Diverticulosis is common. Most people with diverticulosis never develop diverticulitis. You don't have to avoid nuts, seeds, and popcorn. Lifestyle changes matter in order to reduce your risk of diverticulitis if you have diverticulosis. Know the warning signs that may need to be a trip to the emergency room. If you felt like you learned something from this diverticulosis and diverticulitis video, please check out this other video. I release evidence-based GI health related videos on a weekly basis. Take care.